I thought I wanted to be a doctor. And so I did all of the prep work to be a medical doctor. And then I realized that I wasn't necessarily interested in medicine per se, but I was interested in health. And the medical profession, at least from my perspective at that time, wasn't necessarily interested in health. They were interested in other things. I did some things after undergraduate school to see if I really wanted to be a doctor. I was working in a free clinic in Washington, D.C. And then I realized that I liked policy. Like policy was driving what was happening. I also, because the clinic was free, I noticed that there were some inequalities in terms of who could get good care. And individuals that I worked with and for at the clinic, they were dedicated. But the problems that people were coming in with had a lot to do with their socioeconomic system. And so they were often sicker. A lot of the chronic diseases that people were presenting with had to do with economics, their access to good food, good housing, just overall life. I spent about 10 years working in Philadelphia for a nonprofit, and I got to see again the impact of economic disparity and how people of color, or Black people in particular, were impacted. And so I started to look more at that. And a lot of my client base were women. And I saw how women who spend most of their life taking care of other people at a certain point in their life, they did not have the same ability to have people take care of them. So I started to look at what is determined to be economic insecurity, particularly in older African American women. And that was my thesis when I was in my master's program and later became the basis of my doctorate.